Hi, welcome to Hillcrest Pharmacy. I'm Tom Bennett.
I'm Simon. I'm one of the pharmacists here too.
I'm Ben, I'm the intern pharmacist here.
And this month we're talking about men's health issues. This is Movember. As you can see, we're growing our moustaches. Well, you can see those guys, but you can't see mine. Growing our moustaches in support of men's health. I want to ask you guys a question: is why do you think men's health is an issue in New Zealand?
One of the main areas where men neglect their health is they don't tend to value it in the same way that women appreciate the importance of health and overall well-being. I think we're probably not used to having conversations around health, and we tend to either ignore health problems or we tend to keep them to ourselves. I think that's a big part, apart from the biological differences. I think it's a social problem as much as anything.
It's quite interesting that you say that, and the fact that we don't value health is reflected in some of the statistics. I mean, men die earlier than women.
Yeah, it's quite significant. I think it's about 3.5 years longer that women live than us men, which is quite a bit.
It's a tragedy that Māori men can be diagnosed at the same stage as their cancer, but then die earlier than a non-Māori person. And there's some factors that contribute there, and that may be the way the system engages with Māori.
I think probably there's barriers there that perhaps we can get better at overcoming to enable our men to access good health care. Hopefully get better results once they engage in the treatment process.
Well, I think there's a few other factors as well. I mean, like Māori men are more likely to smoke as well. So about 33 or so percent, a third of the Māori population smoke. Respiratory disease in itself. I mean, lung cancer is one of the big causes of death among men, and that smoking obviously contributes to that. But then within the Māori population, there's also this chronic obstructive airway disease or pulmonary disease, COPD. That's reasonably high among the Māori population. And while in Māori men and Māori women, the difference isn't great between them, they might contribute to poor respiratory function, especially if they're smoking as well, smoking and COPD.
I think with COVID being one of the topics currently too, the importance of managing respiratory disease is going to be very important to prevent the ongoing impact of COVID.
So in regard to COVID, one of the big things you wanted to prevent is the serious complications which can lead to death. And even with men overseas, there's a trend that is showing that men are 1.7 times more likely to die from COVID, which is quite significant. And we hope that doesn't translate to what we see in New Zealand, but it could well be the case.
Yeah, well, we've been really fortunate in New Zealand that there's been some good management strategies that have prevented the pandemic spreading widely in New Zealand. So we don't see those sort of statistics, but it could happen if the COVID pandemic becomes wild in New Zealand and men don't and women don't get vaccinated. So I think vaccination is a really important thing for men again. And Simon, you hit on this issue about what men value.
Yeah, I think there probably needs to be a growing awareness and appreciation that health is our wealth, and you can sacrifice your health in the pursuit of wealth, but without your health, your wealth is not worth anything. So I think having conversations around health things, being able to draw on other people's experiences and the resources that are part of the social networks that we have is an important way to get the message that men's health is important and it's part of the wealth of our society. To protect and to nurture that.
And what would your message be for men, Ben?
It all just begins with talking about it. I've flattered with a whole bunch of guys over the years, and it's not really been much of a conversation that we have. I know that just mentioning it and bringing it to the forefront of our conversations is where we've got to start, particularly around things in relation to mental health. In my age group, that's a huge thing. It's super important that we don't ignore those things and those hard conversations.
Yeah, talking about it with your mates. There's two things there, aren't there? It's looking after the relationships you have.
Totally, yeah.
You know, it's important that you have good relationships because then you've got people to talk to. That's part of the key. Looking after your body.
Yeah.
You know, exercise, don't smoke, reduce your drinking, eat healthy. And get vaccinated. I think, you know, there's some easy things that we can do.
Yeah. Particularly at this time.
Yeah.
We don't want to reflect what the world's seeing with men having more deaths from COVID, so one thing we can do is get vaccinated.
I'm looking forward to talking more about. There's got some interesting topics coming up next week. I'm looking forward to talking to you guys more about that. Good on you.
Yeah,
Thanks, guys.
See you next week.
Thanks for watching. Our pharmacist team are looking forward to talking to you more about these important men's health topics. Catch you again next week on our YouTube channel.